Okay, so now we'll be talking about the drug receptor activity. So we have an agonist, we have an antagonist, we have a partial agonist, and we have an inverse agonist. So agonist, see what happens is when you give a drug, I'll show you the graph. Yeah. Okay, so when you give a drug, this is the concentration of the drug, and this is the biological effect. When you give a drug, there'll be it has to occupy the receptors, and the drug which can produce a full maximum effect, that is full biological effect, than compared to the ligand itself, that endogenous ligand itself is called as a full agonist. So it will produce maximum biological effect than, if for example, if our body if for example if a hormone produces a biological effect, if the and if you give a drug similar to that of hormone and produces a maximum effect, that is called a full agonist. So there's always a basal activity. So for example, there's 15%, when you give a drug, 15% of 15% receptors that are being occupied will always produce a basal biological effect. Now a full agonist is what is shown here. A partial agonist is when you give the drug, when you give the a concentration of the drug will, partial agonist is, it will not produce the maximum biological effect. So the biological effect will be less than compared to that of the pure agonist. So that is what is called as partial agonist. And inverse agonist, it is not like antagonism. What will it do? It will stabilize. It will see if this 15% biological effect, after giving the 15%, it will stabilize, and it will also decrease the agonist action. It is not an antagonistic action, it will just make it as a stabilize. It will not produce maximum biological effect. So this is what is seen in agonist, partial agonist, and inverse agonist. Okay, so for example of inverse agonist is see this DMCM or beta carbolin. So DMCM and beta carbolin, it is an inverse agonist on benzodiazepine receptor. Now see, benzodiazepine receptor, diazepam is an agonist, so it will cause sedation. All right, but what happens is it will cause sedation. So this is what, because it causes CNS depression, so it will cause sedation. But what happens here is when you give a beta carbolin, it will cause CNS excitation, seizure. So it will produce an opposite effect. So it will stabilize the receptors. This is, so it will stabilize the receptors, and it will neutralize the basal activity of the drug. So this is opposite effect is being produced. Whereas if you give an antagonist, for example, flumazenil is given for benzodiazepine receptor, and if it antagonizes, nothing will happen. It's not going to produce seizure. It's not going to produce CNS excitation. Thus, nothing is going to happen in case of antagonist. So this is the difference between beta carbolin and inverse agonist and antagonist. Okay, so we have physiological antagonists, we have pharmacological antagonists. Physiological antagonists are nothing but the two drugs act on different receptors and produce opposite action. See, antagonists, we have competitive and non-competitive. They both act on the same site where the drug, the agonist and antagonist will go and attach, and then they will produce opposite reaction. But physiological is not like that. For example, histamine and adrenaline. See, when you give adrenaline, when you give histamine, you have bronchoconstriction, you have vasodilation, you have anaphylaxis. That is in case of shock. But when you give adrenaline, it's not going to act on H1, right? Adrenaline is going to act on alpha 1. It is going to act on alpha 1, and it will cause vasoconstriction, it will cause bronchodilation. So that is example of physiological antagonist. Similarly, you have insulin and glucagon, which is also an example of physiological antagonist. Now, competitive agonist. See, agonist and competitive agonist, again, there are two types, reversible and irreversible. So, there's a receptor, the agonist will act here, and the competitive agonist will also act here. This is what an agonist alone will produce, that is our biological effect, what we studied earlier. Now, a competitive antagonist will produce the same biological it will reduce the potency of the drug. Alright, it will act on the same site and will reduce the potency of the drug, but the what do you say, our maximum biological effect will be produced by the competitive agonist. So this is the difference between agonist and competitive agonist. In case of irreversible in case of irreversible antagonist, what happens is the efficacy. So in competitive agonist, potency is reduced but efficacy is the same. In this potency, in competitive agonist with irreversible antagonist, what happens is the potency is also reduced and the efficacy of the drug will also be reduced. So this is known as irreversible antagonism. Now also there's another thing called non-competitive agonist, where the drugs act on the same site. See, this non-competitive agonist, there's an allosteric site where the agonist and antagonist will act, and then there's an allosteric conformational change will be produced, and what happens is the same thing as that, that is efficacy of the drug is reduced, but there is no change in EC50, that is there is no change in the potency of the drug. So if we all plot this in a graph, so what do we find? Yes, okay, so competitive agonist, as I told you, in competitive agonist the potency will be reduced but the efficacy will be the same. Potency is what we tell it as Km, or EC50 is same as Km, dose at which 50% of the biological effect is produced. Km is equal to EC50, okay, and Vmax is equal to Emax, that is efficacy of the drug. So this is competitive agonist. Non-competitive agonist is, I told you, allosteric confrontational change is seen. So you will have Emax will be reduced by EC50 will be the same. I mean Emax will also be reduced and EC50 will be the same. So Emax is equal to Vmax, so efficacy of the drug will be reduced but the Km will be the same, that is our EC50. 50% at which the drug produced the biological effect will be the same. This is what we see in see allosteric agonist, non-competitive. There is a separate allosteric site, not the same site. I'm sorry, it's not the same site. If agonist acts here, there's an allosteric site, which is a different allosteric site, which the drug will go and attach here, and it will not allow the agonist to go and attach the receptor. This is what is non-competitive agonist. So that is examples for all these drugs are competitive irreversible drugs are ACH and atropine, and carbamethamines and cholinesterase. Irreversible are OPCs and acetylcholine ACH esterase acetylcholinesterase, and non-competitive are carbon nanohydrate inhibitors, that is acetylzomide. They are all non-carbohydrate inhibitors. So this completes our pharmacodynamics.